Dr. Patrice Harris, President of the American Medical Association. Physicians, healthcare professionals, our entire country is quite concerned about the current pandemic and the disease of COVID-19. So I am happy to be joined today by Dr. Stephen Stack. He is an emergency physician. I am a psychiatrist, and so we both bring the unique lens of our specialties into this pandemic and really action as to how we address this pandemic. So, Dr. Stack, thank you for joining me here today, and I appreciate your work on the front lines there in Kentucky.
Well, thank you, Patrice. It's good to be here.
So I know you are hearing a lot from the physicians in Kentucky. I am hearing from physicians all across this country, and they are raising concerns regarding equipment and tests. What are you hearing from physicians in Kentucky? And what do physicians need to do, physicians and other healthcare systems? What do we all need to be doing?
Well, Patrice, that's a real problem. So obviously, if a large portion of the population gets sick and gets critically ill in a very short period of time, we run out of supplies. And most of us rely on a supply chain that's often as short as a 3-day just-in-time logistics supply chain, meaning that most hospitals and others keep on hand just enough materials to get through the next few days because they have a steady stream of inventory coming in to supply these materials. Well, remember, most of us rely on China for a lot of these materials, and China was the place that was first hit. And now we have problems across the whole world where countries like China and South Korea and Italy and Iran, and now you have Spain and France, and of course the United States are facing this challenge all roughly at the same time or over a very short period of time. So the supply chains are disrupted. And of course, people who work in factories and other places need to do social distancing, so it makes it harder for them to operate in their normal manner. So what I have told physicians, what I've told leaders of hospitals, you must operate under the assumption that the PPE you have is all you're going to have, that the resources you have are all you are going to have. This is why we've taken dramatic steps in Kentucky to tell all hospitals and all medical providers that non-emergent and non-urgent medical care must cease immediately, because we have to very quickly free up as much capacity in our hospitals as possible in order to ensure when the numbers of sick people start to increase, that our doctors, our nurses, our respiratory therapists, our pharmacists, and our paramedics, that all of these people in healthcare are fully available to help people who are most in danger and most in need. So, Patrice, I hear the frustration that the doctors and others are sharing about where's more material. But I'm going to tell you, there's no finger to point at someone else in this instance. The whole world is facing this. This is a global pandemic. We're all in this together, so there is no one else to point fault at. We just have to find a way to respond in a situation where the needs greatly outstrip the resources, and yet we have to find a way to get through it. But I won't end any of these things that I say to you without constantly reminding people 80% of folks are going to be fine, and we will get through this, but we'll get through it because we rally and come together and we take these steps quickly and comprehensively to try to free up capacity and minimize the burden of disease.
So yesterday, the AMA sent a letter to the administration calling for a Marshall Plan of sorts to make sure that physicians and other healthcare workers have the equipment that they need, personal protective equipment, the tests, the swabs, the chemicals needed to run the test.
So, Patrice, I understand that the AMA issued this Marshall Plan call to action yesterday, and I like history, as you know all too well. And so George Marshall was the one who helped organize the U.S. military response during World War II. And in a very short period of time, the United States had to take a really small army and ramp it up by about a factor of 80-fold increase over a 2-year span. That is what we're facing right now. The Marshall Plan itself was actually the reconstruction of Europe after the World War II military action had come to a close, but that was nothing short of the complete rebuilding of the continent of Europe. in those analogies are applicable. I know people have a hard time putting that in context, but this is really the calm before the storm. Think of it this way. It's like there's a Category 5 hurricane out to sea about 7 to 10 days away. And we know it's going to come and we know it's going to hit, but if we take action now, we can take steps to protect people and to ensure people have what they need to survive the onslaught of the hurricane. That's what we're facing. And so your Marshall Plan call to action, I think, is absolutely appropriate in this setting. And we need more resources. We need the federal government because it is the entity in our nation with the most resources and capacity to come up with ways to rapidly build supply chains, to make testing widely available, to make PPE and other necessary medical resources widely available. And because we know that we are unleashing intentionally great harm on people by shutting down businesses, by decreasing our social interaction, by shutting down schools in order to keep people safe and prevent preventable deaths, we know that there is going to be an enormous effort required after this passes to address all of the economic implications of what we've done. So Patrice, the analogy of the Marshall Plan, I think, is about as fitting as any analogy I could possibly imagine. And I think that's why it is so important for physicians in this country and everyone else in this country to understand this is not a drill. We'll get through it, and we'll get through it better because we rally together, but we must rally together in order to get through it as well as we're able.
Well, thank you so much, Steve, for joining me today. Certainly, each region is different, each state is different with different assets. But I think it's important that we highlight the partnership required in this effort. And so thank you for telling us about what's going on in Kentucky. Again, it's important for all of us to work across systems and across levels at the federal, state, and local level. So thanks to you today and best to you and your state of Kentucky.
Well, Patrice, thank you very much. It's been a privilege to be here. I wish you the very best, and I thank you for the AMA and the leadership that the AMA and the physician members of it will project to the country in the weeks and months ahead.
In these difficult times, it is important to remember self-care. It is also important that we use social media responsibly. We certainly will be using social media more to connect and stay connected, and that's important. But we should also monitor the amount of time we are on social media and make sure we are getting our information from reputable sources. So finally, let's remember that not everyone has equitable access to resources, certainly at baseline, and definitely not during this pandemic. It is important that we address that fact as we develop efforts to address the COVID-19 disease. The AMA has developed a resource page on COVID-19 for physicians. Please go there for additional information.